as U.S. citizens, have the right to health care? Do we have the right to health care? I said no, and that is because it's not in the Constitution. If you look at the 14th Amendment, the closest you will find to any way of construing a right to health care is in no state shall deprive any person of life, liberty, property. But this is not a positive or affirmative right. It's merely saying that we have the freedom to life. So the following question is, should we have a right to health care? And I also said no. Why? Because it positively negates the inalienable rights of others. And by this I mean doctors, healthcare providers, and the healthcare profession in general will be forced to bear this burden one way or the other. And as a practical implication of that, it deters would-be healthcare professionals from entering the medical field, and because they would, one, make less, and two, work harder. And aside from that, there's already a large shortage of doctors in the U.S. Second primary reason is, where do you draw the line on civil rights? And this comes in large part from patient abuse of the system. For example, it's easy to say, if someone has, say, a cancer and they need treatments, it's easy to say, yes, let's give them a right to health care. But then what about someone that has a gastric bypass surgery? What do we say then? Because, did they not contribute to the cause of that? Or maybe they didn't contribute to the cause of that. Maybe they needed it for health reasons. So it gets complicated. The lines blur. Okay, now let's reconcile my denial of any fundamental right to health care with reality. This is actually facts from a plea I found on the internet. Someone has posted, they're pleading for help, and this is a situation that's all too common. Jessica's plea for help. She's suffering from incredible pain. She got cut off of Medicaid because she turned 18. There are no jobs in her area. She's desperately trying to find a job. She doesn't have the money to drive to find a job. She's talked to caseworkers. There's no one health insurance for free, and the doctors won't see her because she doesn't have insurance or payment plan. Again, more reality. This girl has since passed away, but we have Trina's story. She is pregnant with health problems. She sought help at a clinic, but she was turned away because she had a balance due, and the clinic would not take her unless she paid $100. So what did she do? She eventually sought care at a hospital 30 miles away, where she died. And these scenarios can never happen to you, right? So let's take a hypothetical. You have health insurance right now, and the doctors discover you have diabetes. Okay, so you're going to be covered, and you're going to say you visit the doctor's office 3 times. Well, the insurance company decides you're costing them too much money, and that you had a pre-existing condition, and that led to your diabetes. So they drop you. You can't afford to buy any new insurance now. What do? Well, what really can you do? You can always go to the emergency room at the hospital. They cannot turn you down. The problem is, this is no answer. When you take a visit to the emergency room, this is no substitute for regular care, preventative care, or treating problems before they become bigger, or longer lasting problems. If you need chemotherapy treatment, the emergency room is a one-stop thing. It is not a continued place to get health care. And even so, uninsured Americans still hesitate to even go to the emergency room because they're fearful of ER bills. So what can you do about non-emergencies? Nothing. It's good luck. That's what the research shows. Is you really have, you're stuck in a bad place.
It should be SOL.
And so this leads me to, there's no equality in healthcare. The United States ranks dead last on all the measures of equality. We have the greatest disparity of quality of care given to the rich and the poor. And just aside from that stat, 36 million do not have health insurance. Now that number will be disputed by some, and there are different numbers from different people. What I've tried to do is compile what I think is the most realistic number, because you often hear of 46 million people in the media. Well, that's counting illegal immigrants that are here illegally I did not count them because this is just over American citizens. And also in that number, in the 46 million, I feel I should note that 17 million of those may have household incomes of 50,000 or more, and they choose not to get health insurance. But even a household of 50,000 or more has trouble coming up with the money needed for health insurance. And let's continue on this. Minorities are hit hardest by this inequality. And